everyone. Today's video we are going over a case study of a long distance runner, trail runner, who had inner knee pain, kind of groin and outer hip pain during running, and would last for 2 to 3 days after running. So we're going to go through what we did for her. My name is Dawn, this is Seb.
Hello.
We work at Performance Place Sports Care in Costa Mesa. We are the locally world famous chiropractors here. And we're just going to get right into kind of how this woman presented. She was actually a virtual client, so I didn't actually get to see her in person. So I took her through a movement assessment to kind of get a handle on what was going on. She would complain of inner knee pain. She'd point here, that kind of went down underneath the patella here. That would occur only when running. It would pretty much start at the beginning, maybe get a little bit better sometimes, but it lasted the whole time throughout her runs. So she had to start cutting her runs short. She was even questioning just not doing it altogether. And then her hip pain, which was located a little more, not necessarily groin in here, but kind of like upper groin and outer glute. That would happen after running, maybe a few hours after she's cooled down. She'd start to feel soreness in that area, and it would last for 2 to 3 days. So she wouldn't run on those 2 to 3 days. Once the pain would go away is when she would run again, but it was just the same cycle over and over.
What did she think it was?
I think she was mainly concerned about the knee pain, so she wanted to know if there was anything really truly structurally wrong, if it was okay for her to continue running or not. We have worked together in the past, so she just kind of was reaching out to see if she needed to stop or if there was just things that she could do so she could continue running. Yep. So ultimately in her movement assessment, I coached her through range of motion, which was just standing up, bending forward, backwards, side to side, and some rotation. And what we're looking for with that range of motion is to see if we have any associated symptoms like low back pain on the same side, if it recreates hip or knee pain when we do it. And it actually recreated her hip pain when she was leaning from side to side, just with some spinal motion. We also did some hip kind of movement assessments, and she would feel that hip pain when she would bring it into her chest, and it would make it a little bit worse when she brought it across her body. And also when she was squatting, she would shift into the opposite side, so kind of getting away from pain, she would shift into the opposite leg, but would also feel her groin pain with that. And for the knee specifically, we tested how did it feel to sit on her knees in flexion, and that would recreate tightness into here. And she said, I don't know if I want to sit here for very long.
So this is all kind of that virtual.
Yep, all the stuff I took her through virtually just to see if we had some outcome measures. And then also standing up and going through a little bit of rotation on that knee, she would also feel that tightness as well. Questions so far?
Well, what song did you imagine she was singing when she was dancing like that?
I don't know why the first thing that pops in my head is, staying alive.
So, based upon what you saw in the virtual then, is there any way to tell if she had something she was still able to run on? Like, it sounds like you were testing for meniscus and patellar tendinopathies. Like,
yeah.
How can you know in a virtual?
So ultimately with something like that, the first thing I wanted to do, because twisting through the knee like that and sitting on it in flexion, it can sometimes be indicative of a meniscus issue. So we have this little trick that you guys might have seen on our YouTube page about knee pain, where we kind of play with skin rolling to see what that does. So actually, can we show on you? So Seb here is going to show you where her knee pain was on the inside there, and what we did is I coached her through how to go through skin rolling of the spots that were tight for her. So we spent about a minute or two together just kind of coaching and taking her through this, also kind of going down underneath into the patellar where she felt that pain. We stood up and we twisted again, and she said, I don't feel pain anymore.
Yeah, why do you think that worked?
Because it wasn't anything in the knee that was actually creating her pain, which to me told me, wonderful, we probably don't have to worry about a meniscus issue here. It's likely okay and safe for us to still continue running. And this also just gives her a nice little way of controlling her pain. Maybe she stops in the middle of her run real quick to do this, and now she can continue running. It's not a end-all be-all, but it's a nice little tool to have.
Yeah, just kind of rolling through the skin and just not pinching it, but just kind of grabbing and wiggling and finding the spot, right?
Exactly.
Pretty tender though.
Yeah. And so then if she sat back on the heels again, the tightness wasn't perfect, but she looked at me like, wow, that's significantly different. So when that happens, I tell her, you know what, then it's likely not the knee, it's just taking on a lot of work. So we want to look either below or above that joint to see what's going on. We already know she had some hip issues going on up above, so we chased that more than anything so that the knee could relax and we just improve stuff up here.
I'll play devil's advocate then. What if one of the viewers is watching this and you said, well, the skin rolling really helped, so you can say it's not the meniscus, but I have a positive image showing that I had a meniscus fray. So how does that matter to me?
Well, so there are times where we can find positive findings on imaging. What's really, really important is to not just solely rely on imaging findings, but to kind of take the whole picture together. History, examination, and imaging findings to see if that was really truly the cause of her pain or not. When it comes to meniscus stuff, we want to know how bad is it, how long has it been going on, is your knee unstable? There's so much about that we won't get into in this video. With her specifically, we just knew if that helped her, that the meniscus itself was not the cause of her pain.
Yeah, well, even a meniscus too, like, so locking knee is really the main surgical meniscus. Everything else is kind of just rehab, even if it was.
Yep. So what we did was, after that, once we got rid of knee pain, we kind of chased up to the hip, and I wanted to see if we could get rid of hip pain. If we recall, she had pain with just moving her spine in her hip. So I took her into a side opener position. We're going to quickly go over this. So her pain was on her left side.
Okay, can I go right side
Of course,
of that microphone?
pretend it's right side.
Okay.
And so what we do is we take a little wedge and we shove it between the hips and the pelvis. We want problem side up here. So what we did is I kind of coached her into this position over camera, made sure that she wasn't leaning backwards into the low back. Exactly. We always wanted her kind of looking down towards the floor. Really wanted her to create a nice rainbow with the side of her body. I think at first she'd feel a little whisper in the hip, so we just gave it a second. It eventually went away.
Do you say whisper?
Huh?
Do you say whisper?
Whisper. We slowly worked her backwards into more of this position. Right here, she'd feel it again, so we'd hang out and we'd wait. The moment it would go away, we'd go all the way backwards, drop the knee to the floor, and now she's in this nice open position. We get back up, we do all the things that recreated her hip pain in the first place, and all of that was feeling so much better with just skin rolling and this position. That's not something where I say, good, do this and go continue your long distance running. We now want to build support around what we figured out is going on with her. But this one here just kind of offloads the hip, offloads the side of the spine that could play a role in the pain that you're feeling in your hip. So this is ways for her to control her pain. And now we're looking for more long-term benefit.
When you said her hip pain changed when she moved her spine, that doesn't put any, that doesn't load the muscles of the hip?
It totally does. There's no way of really truly isolating. I mean, we probably could, but specifically with her, all we did is it just took a minute or two. If we just offload this and retest your hip again, and it makes you feel better, now you have a tool in your toolbox to control pain after running. Remember, it was soreness after running. She didn't know what to do for it. Boom, here you go. Spend 1 to 2 minutes and now your soreness is gone and you can run a little more.
Yeah, nice.
Cool. And so come on up out of that. I'm going to slip this out from under you.
By the way, if you guys want to learn a little bit more about hips and groins too, we have a webinar in the corner, which is really, really great. Dawn's on there again.
So remember that she also shifted in her squat away from her pain. We wanted to make sure she was loading that hip properly. Yep, exactly. So we want to get her to be able to shift back into that hip so that maybe she's just moving a little more optimally and using those muscles properly. So we're going to put you into a diagonal sit position because that's what we did for her.
Let's do the left side.
Okay.
Although you would have done the side of symptom. Is that
For
what you
her
did?
specifically,
You
we did
left.
side of symptom because we wanted to get the pain out of her hip and more into glute activation. So, yep, exactly. Go ahead, perk up here. Knee through the floor. Come on up. Good. He's up off the floor back here, enough for like a little critter to crawl through. He's going to hold. He's going to take this toe, maybe dip it a little further there. And where are you feeling this? Side glute. Slowly sit down to tap the butt to the floor. Go right back into it. Beautiful. And so, yes, Seb has done this exercise a bajillion times. He knows how to do it perfectly. But the beautiful thing about having somebody coach you through this and watch you is a lot of times you'll see weird things. Or say this is groin pain here, right? Like, oh, I'm feeling my groin with this. Well, then we can coach it a little differently. Let's get the ribs down. Let's cue it differently. Let's change the knee position. Now are you feeling it in your glute? Wonderful. So we had to tinker with it for her for a little bit until we got it into that glute. But once we did, then we loaded it like crazy. We really wanted her to feel some insane contraction going on there. And then we got into those things that test her hip again. And it was still feeling pretty darn good.
Yeah, you described this as a bicep pump of the glute before.
Exactly.
Yeah, so some of our viewers who may have been around for a long time, they may have noticed that we do coach a lot of similar exercises for similar conditions. You can give this diagonal sit for a sports hernia, adductor strain, gluteal tendinopathy, low back pain, sciatica. I mean, it really depends how you coach it.
Exactly. That's all it is really just coaching it specific to the person, their body, and their injury. And we don't want to keep people with these floor exercises forever. We want to be able to progress them towards their goals of whatever they want. So for her specifically, I want to be able to go back on my trail runs and I want to compete in races in the future.
So as you can see, we can coach them. This was virtual that you saw them. Yeah. Okay. So did you ever see them in person?
Nope.
Okay. So, but you can get enough information on the virtual to suggest and also coach. You got to be creative with your wording. So if you guys are looking to work with us, we can work with you, or at least we can screen your case to see if we can work with you. Contact is in the description below. Check the link. Watch any other video we have on the channel. We have a lot of videos on this that you can go through all of the search bar and type in whatever you want.